Hello everyone, welcome to Notes Gurukul. In this video, we will study about the difference between reversible and irreversible pulpitis. So pulpitis means inflammation involving the pulp. So let's see what is reversible pulpitis. Reversible pulpitis means that the pulpal inflammation is reversible in nature. That is, the tooth can again come back to its original state. Whereas irreversible pulpitis, as the name suggests, means that the destruction inside the pulp is irreversible. That is, it cannot be reversed back. So that means in reversible pulpitis, pain occurs when a stimulus is applied to the tooth. Now this stimulus can usually be either cold or sweet stimulus. So pain occurs when we apply stimulus, but when the stimulus is removed, the pain stops within 1 to 2 seconds. Whereas in case of irreversible pulpitis, the pain occurs spontaneously or it lingers minutes after the stimulus is removed. So in reversible pulpitis, there is sensitivity to mild discomfort. Whereas in case of irreversible pulpitis, pain may be present. Okay. In reversible pulpitis, there is sharp shooting pain on stimulus sensation. So when we apply stimulus, then only there is pain. When we stop the application of stimulus, there is no pain. Whereas in case of irreversible pulpitis, there is spontaneous lancinating pain or there can be dull continuous pain. So this is the characteristic of pain in reversible as well as in irreversible pulpitis. In reversible pulpitis, there is sharp shooting pain, whereas in irreversible pulpitis, there is spontaneous lancinating or dull continuous pain. In reversible pulpitis, the pain subsides soon after removal of stimulus, whereas in case of irreversible pulpitis, pain is often moderate to severe and it lasts for a longer period of time. In reversible pulpitis, there is infrequent episodes of discomfort, whereas in case of irreversible pulpitis, there is an increased frequency in pain. The pain is often to the point of being continuous. So there is continuous pain. The pain usually lingers, especially with increasing episodes. Thermal stimulation often elicits severe lingering pain. It may be able to identify specific or multiple stimuli. Okay. The pain radiates or if diffuse or may be localized. Now let's see what happens in reversible pulpitis. The common etiologies involved are exposed dentine, cracked restoration, recently placed restoration, initial caries attack or rapidly advancing caries or altered occlusion may be the reasons. Whereas in irreversible pulpitis, the etiology are history of trauma, extensive restoration, periodontal disease, extensive recurrent caries. Symptoms involving reversible caries usually subside immediately or shortly once the stimulus is removed, whereas in case of irreversible pulpitis, patient often requires time and medication for the relief of pain. Now let us see the radiographic changes associated with reversible pulpitis. In reversible pulpitis, the radiographic changes approaching the dental pulp can be seen without involvement of any radicular pulp. So radicular pulp is not involved, but radiographic changes can be seen approaching the dental pulp, whereas in case of irreversible pulpitis, the radiographic changes involves the pulp, okay? And it may include calcification, resorption, and radiolucencies. So as you can see in the image below, that in reversible pulpitis, the carious lesion has not reached the pulp, whereas in case of irreversible pulpitis, the disease has progressed towards the pulp. And finally, it leads to necrosis if it is left untreated. So, what should be the treatment plan in case of reversible pulpitis? So, the first treatment is remove the irritant or repair the tooth structure. If there is caries, exposed dentine, or defective restoration, then repair the tooth structure, remove the irritant, and continue to monitor the patient's symptoms. Advise the patient to return if symptoms persist or worsen. Now let us see some treatment involved in irreversible pulpitis. Usually endodontic treatment is advised in such cases as the pulp is involved. So there is complete removal of the pulp required, and if treatment is undertaken and the appointed treatment time permits, then root canal treatment can be completed in one visit also. And if such cases are left untreated, ultimately they may lead to pulpal necrosis, and further it will lead to dental abscess and infection. As you can see here, there is a periapical lesion involved in this. So if such cases are left untreated, gradually they will soon turn into periapical lesion.